Hi, I'm Dr. Tiffany Libby, and I'm a board-certified dermatologist and a mom of 3. Keep babies in the shade whenever possible, especially if they are under 6 months old. Dress them in lightweight UV protective clothing that covers and protects their little arms and legs, as well as accessories such as wide-brimmed hats that cover the neck. Try to limit sun exposure during the hours of 10 to 4 p.m. when the UV rays are the strongest. If shade is unavailable, apply Mineral Sunscreen, which contains zinc oxide and/or titanium dioxide on small areas of the face, as these ingredients are less likely to irritate baby-sensitive skin. The American Academy of Dermatology recommends that children 6 months and up should wear sunscreen. Yes, everyone needs sunscreen, and children absolutely do too. Research shows that it's critical to protect children from the sun as much as possible, as sunburns during childhood can lead to a higher risk of developing skin cancer in the future. Practice sun safety by limiting time in the sun for young children when the sun is the most intense between 10 and 4 p.m. Be mindful of the clothing they wear so that it is protective yet breathable, and don't forget hats and sunglasses as well. Every day. A major misconception is that you only need sunscreen during the summer or only on sunny days, but 80% of the sun's ultraviolet or UV rays can get through clouds and can even reflect off sand and snow. So it's important to wear sunscreen anytime you're going outside. Families who live in areas with strong sun exposure or at high altitudes should be especially diligent about their daily sun care. You'll need sunscreen every day, but it's also really important to reapply. Generally, sunscreen should be reapplied every 2 hours, but if you're swimming or sweating, it will need to be done more often. So check your sunscreen to see when you should reapply after swimming and sweating. For young children, I would recommend using a product with a broad spectrum coverage against ultraviolet or UV rays and with a sun protection factor or SPF of at least 30. An SPF of 30 provides 97% protection against UVB rays, and an SPF of 50 blocks out 98%. You'll also want to look for water resistance. You can find all of these labels on the front of your sunscreen bottle. For sensitive or eczema-prone skin, like my kids have, I recommend looking for fragrance-free sunscreens with mineral filters like zinc oxide or titanium dioxide. These are 2 naturally occurring minerals that are non-irritating and extremely safe for sensitive skin, which makes it a great option for babies and kids. So there are 2 different types of sunscreens in the US: mineral, also known as physical sunscreen, and chemical sunscreens. Traditionally, we think of mineral filters as sitting on top of the skin and acting as a barrier to the sun's rays. The main mineral ingredients are zinc oxide or titanium dioxide. The other type of sunscreen is chemical. Chemical filters work differently in that they absorb the sun's rays, convert them into heat, and then release them from the body. Yes, zinc oxide tends to leave a white residue, but there have been great advances in formulations, and there are plenty of elegant zinc oxide sunscreens that blend in well or are made with clear zinc so that there is minimal to no white cast. So for me and my family, it's easiest to apply sunscreen on at home before getting dressed to ensure an even application, or we apply it right before leaving the house. I like Mustela's family-size mineral sunscreen pump bottle with SPF 50, as a pump makes it a lot easier to apply an adequate amount of sunscreen for the whole family. I also love sunscreen sticks for applying to kids, and they're great for applying around the eyes and for quick touch-ups when you're on the go. Remember to reapply every 2 hours and sooner if your kids are sweating or swimming. It is so important to stay hydrated, inside and out. After a long period of being exposed to the sun, your body as well as your skin will be dehydrated. Make sure to give your kids plenty of water to drink and apply moisturizer to rehydrate the skin. Sunscreen can be really tricky to remove. I like to use a washcloth with a mild oil cleanser and gently wash the face and body. You can also use micellar water on a cotton swab or reusable wipe to gently remove the sunscreen. Good question, because despite our best efforts, it happens. Keep your child hydrated to replace lost fluids and keep them out of the sun until the sunburn is healed. You can give pain medicine to help relieve painful sunburns and use a cool compress for relief. Moisturizers with aloe vera or soy help soothe sunburned skin. And make sure to protect sunburned skin while it's healing from further UV damage.